Hey guys, my name is Hopkins Langler and welcome back to another YouTube video. For today's video, I'm going to be talking about my placement. So I just had my first placement under my Master's Physiotherapy degree, and this is going to be like a reflection piece. As a healthcare professional, we are advised and strongly encouraged to reflect. In everything we do, we must reflect, and I'm a big fan of reflection. I don't always write down my reflections, sometimes I like to think about it and stuff like that, but with this one, I'm in the process of writing it down, but I also thought I think it would be good for me to make a video reflection as well. So if this will be good for me, I'm going to make sure to do one for all of my placements, but also really good for you guys. So anyone who wants to go into physiotherapy or speech and language therapy, so anything in the healthcare professional field, we advise to reflect. Just me showing you how I reflect and what I go through will be able to prepare some of you guys into your current course or what you're about to get into. Please make sure to like, subscribe, share this video to all your friends and family. In the physiotherapy master's and undergrad degree, students need to complete 1,000 hours of placement. So you need to complete 1,000 hours of placement to become qualified. So the way my university broke it down, we have 5 placements and they're all 6 weeks each. So 5 placements in different places. So I done my first one as a paediatrics physiotherapy. So I guess I'll start from the beginning. My first week at my placement, so I got there and it was really good. I actually got given some prep work just before. So a few weeks before, the manager gave me content to look into so I could be prepared for what I'm gonna go into for this placement. And a lot of the content was just basically common conditions I see in pediatrics. So in pediatrics, you're gonna see a lot of Osgood-Schlatter's, that's knee pain, severs, perfes, and all of these are bunched into what they call apophysitis. And apophysitis is basically, in a short way, growing pains. I make sure to add the actual definition in the video, but essentially it's growing pains. So as children, obviously they're growing and the bones grow faster than the muscles, which leads to a lot of pain to occur at the joints because that's where a lot of muscles attach into. So for example, if we're looking at knee pain, so Osgood-Schlatter's, so at the tibial tuberosity, a lot of kids will experience a lot of pain there, especially if they're very active. So all the sporty kids will experience a lot of knee pain. So conditions like that, you'll see a lot of hypermobility. So kids who are able to do all of that stuff, they're able to do that, they're able to bring their thumb to their forearm. If you ask them to like try to touch their toes, they're gonna end up touching the floor as well, standing up and everything. It's the super mobile kids. I'm sure a lot of you guys know some. And conditions like that, you might see a lot of fractures, so kids get into accidents all the time in the playground playing sports, or sometimes it might just be like a very unfortunate accident. So a lot of that, so I had to read into it. That was the first week basically, just in terms of me understanding the conditions, me shadowing all the different types of physios we had there. It was about me just taking on board all of this information, which was at first was a bit overwhelming. I found it super interesting and I was very engaged, but it did take me a bit of time. It was quite tiring as well. Yeah, so the first week was mainly me taking in information, learning, getting used to just the process really. I also had to learn how to use the assessment sheet. So in the assessment sheet, so when the physicians are assessing the children, just the format, the types of questions they're gonna ask, how to input the type of information. And this was one of my tasks, so one of my goals actually, that I told myself I really want to improve my SOAP notes. So SOAP stands for subjective, objective, analysis and plan. So it's something that we use all over in the NHS, and I wanted to get really good at writing notes because I think it's just a very important skill to have. So whenever you're writing notes, you're able to pass it on to a different specialist and able to understand you instantly. They don't have to think about it, they don't have to struggle to read it, they know what you're trying to say. So that was one of my goals. And thankfully the physio I was showing, she was really good at them and she gave me a lot of feedback. I was able to help me improve that. But again, it took me some time. I didn't get it during the first week. I started to get the hang of it, I'll say probably in the third week. So yeah, I was mainly walking in with the physio, just shadowing what she was doing. So seeing how she would communicate with the patients, because with kids, you can't ask them straightforward questions or difficult questions. It'll have to be so simple for them to understand it. Even to the point where when you get them on the table and you're assessing them. So for example, one problem I did have was when I asked a child to, for example, do hip abduction. I want to assess their hip strength. I'll tell them, okay, go on your side and then just raise your leg, and they'll raise the leg, but then they'll try and fall over, and I'm like, no. So I had to reword the way I'm asking them, or maybe give them a bit of guidance. So just things like that. And I was just seeing the physios do that because they're so used to doing it now. They're doing it every single day. They know how to talk to the patients and get through to them. Not all the time, because some kids are a bit more difficult than others. Some have learning difficulties, or some are autistic, or they might just not understand, or some can't even speak the language. They might have just come into the country, so they're just getting used to everything. There's so many factors to it. But yes, shadowing the physios has helped a lot. And I also went into school. I was helping one of the physios. She goes into schools and helps the kids with exercises. So she might do an exercise plan for them for 20 minutes. And after that, the OT, the occupational therapist, will help them with their writing, with their comprehension. They'll just bounce back from each other. So once they're done with the physio, they go to the OT, which was really good to see. And I was able to experience that, help them out, and learn from both of them. So in a nutshell, that was my first week. So in my second week, I done a lot more. I was able to actually start assessing patients with guidance. So the physio was still in the room, but allowed me to lead the conversation, to make my mistakes, to ask the patients questions, and just to improve on my skills basically. And I found it really helpful because I was able to just, ask the questions, go through it and make my mistakes, and then get feedback from it. And reflecting on it, I feel like the first week I wasn't nervous because I'm used to talking to people now, but it was a bit difficult talking to children because, again, like I stated earlier, just the language has to be different. You need to be able to relate with them a lot more. So I was starting to get the hang of it at the end of the week. But initially when I started, for example, during the subjective assessment, there'll be times where if I had a female patient, a young girl, and then I have to ask them about their menstrual cycle, I find it a bit weird. So I'll be like, ooh, I'm not too sure how to ask this, but it's my job, I need to do it. So eventually it became a lot more comfortable. So that was a lot easier to ask. And there'll be other times where there might be difficult questions to ask. So in our assessment sheet, we need to find out their medical history, family medical history. So in one of them, they'll be asking, I have to ask. And one time I said, oh, have you had cancer before? And then the physio told me, well, after, she's like, next time, don't say that because it's a very touchy subject, because it could bring back a lot of trauma. It's a very direct question, even for the patient, for the child, or for the family. So instead, what you should ask is maybe something like, has the child had any serious illnesses before? And then if they have, then that's when the parents are invited to actually let me know that information themselves, rather than me asking it straight and direct like that. Because again, it can be quite uncomfortable. It could bring back certain trauma. They could have it right now. It could make them feel it can make them feel very sad, basically, just, so just stuff like that. So those are the things I really worked on in my second week, and I thoroughly enjoyed it. Again, it became a lot more easier the second week because I started to understand the conditions a lot better. I also was able to see and actually practice what I've read. So evidence-based practice, basically. All the presentations that the trust has sent to me, I was able to read it. Okay, this is what you should do, this is the type of test I should do, and then do it, apply it onto the patients. And another thing that I've improved on as well is my objective assessment. So learning how to basically measure things by eye. So for example, if I'm looking into someone's hip mobility, so roughly using degrees now to actually determine how far their hip is able to go in internal, external rotation, and new muscle length test, the prone quad length. So that's a good test you do for your quads. The person's on their front, and then you put their knee into flexion. You see how far it's able to flex, and it's able to determine quad length. Popliteal tilt angle. This helps to actually check for the hamstring length, and other bunch of other tests. And just me being able to see the physios do it, and then me doing it myself, making my mistakes in terms of poor hand placements or poor measuring by eye. Eventually I was able to improve on that and get better at it, so I'm a lot more confident in doing that now. And also me just getting used to writing my SOAP notes better, so my abbreviations, summarizing my assessments into a very short paragraph, something that's very easy to understand, so that when a physio picks up my notes, they're able to see, all right, that kid has such and such, and this is what I need to look into. So second week, that's when I started to really ramp onto like doing all the stuff, the subjective and objective assessments with assistance. In my third week, again, again, slightly the same, but a bit more independent. So again, going into the schools, but also seeing the patients myself, and this time by myself actually. So there was no assistance. I was there by myself, and it was great. It was really good. After I was done, I'd go back to the physio and feedback and ask them what I should do next time, or if it was good or wrong. So again, feedback is always important, because for me, although I have my own business and I see my own patients, there's so much more for me to learn. I feel like after graduating, I went straight into my private business, and you know, I'm happy, but there's a lot more I need to learn, and I have developed bad habits over that time, and my placement here has helped me to work on those bad habits and look into things a lot more in depth. So my third week, I was able to be independent, write my notes, and get a lot more feedback into that and see how I can improve things. So thankfully, again, my physio, who was mainly supervising me, my educator, she was grilling my notes saying, this is poor, this is wrong, don't do it like this should be done this and stuff like that and everything. And yeah, so thank you. My notes have greatly improved, and that was the third week. Oh, also in the third week, I went into NICU. NICU is Neonatal Intensive Care Unit for children, and basically ICU for babies. And I can't even lie to you guys, I didn't even know that was a thing. I had no idea. I had absolutely no idea. Going into the department, I had to go to the hospital for that. It was really interesting to see, and quite scary and emotional, because babies in an intensive care unit and anything can happen to babies, you know. And usually the babies that go into NICU are the babies that are not born full term. So full term is when babies are born between 37 and 40 weeks, I believe. That's when the babies had enough time in the womb to develop. And if the babies aren't there long enough and then they get birthed, that's when there might be certain complications. So it could be developmental issues, it could be breathing issues, it could be heart issues, so many different issues that the babies can be in there for whatever, and due to them being born super early. So some kids were even born at 30 weeks. So I think one of the kids when I was there, I think they were born at 27 weeks, so they were super tiny, and it's quite scary, you know, that anything could happen, any developmental issues. And when I got there, I've worked in the wards before, so I was used to them debriefing the staff in terms of like, all right, this is who we have in our ward today, this is what we're gonna get into, and they talk about each baby individually. So this is baby X, they are born such and such date, these are the parents, this is what we found, and this is how we're going to take care of them, this is what we're going to look into. So it's a bit like being like a rest physio when I was there, but they were doing so many, they were talking about heart rate, breathing rate, they were talking about different sort of like medicines and drugs and stuff like that. Like if you study cardio rest, you'll know what I'm talking about. It's just all of these things. I can't lie, I was confused, because I'm not a rest physio. That is not my bag at all. So I was confused, but I was very intrigued. I was listening, and the babies were actually in incubators. So basically those incubators were trying to replicate the womb. So the babies were closed off, the head was supported, they were clothed really warmly, and also they put blankets on top of the incubator so that there's no sunlight, because the babies are gonna be exposed to the light and it might affect them badly. It can hurt their eyes. And in the room there's no light, so we're just trying to recreate that as much as possible, which is really good to see. They were checking the baby's heart rate, making sure it's okay. They're also checking to see if the baby's able to move well, seeing their patterns, which was really interesting to see. And so I done that for most of the day. After that, I got given a bit more learning, educational material. So another 2 presentations to look into what it is. So one of the things they taught me was kangaroo care. So kangaroo care is basically when you're carrying a baby and you're placing the baby on your chest, or on your direct chest, so skin to skin basically. It's able to calm the child down. Also, it's able to help both the parent and the baby build that communication, that trust, just that connection really, which is really good to see, because I've always seen that on TV. The dad will be shirtless and carry the baby on their chest. Now, I never knew, I thought it was just like a normal thing you do, but there's a scientific reason why we do that, and it's very interesting to see. So there was that, and after that I shadowed the OT of the department, who also assesses babies and will basically, so this was the cool thing she showed me. So she got a video of a baby, and the baby was just moving their arms and legs, And then she looks at the video for like 10-20 seconds. She was like, that baby has this condition. And I was like, what? How? It's only been 10 seconds. And she was like, oh yeah, I took this course and stuff and everything. If you look carefully at the pattern of the baby's only moving their right arm and then the left leg. You know, it's not moving the leg sporadically and stuff like that. So the baby might potentially have a learning or developmental issue. I'm like, wow, that's crazy. And I was spun. I was actually spun. So you know, that's what happens when you have years of experience and you go to different courses and, you know, you're able to determine certain things just like that quick, just because of like how much experience you've had. So that was my time in the NICU, and by far I think that was probably my favorite part of my placement, basically, because I'm used to doing the assessments. You have ankle sprain, here are exercises. This here was something so new to me that I'm not used to, and I thoroughly enjoyed it. So something I forgot to mention was also psychosocial meetings, and this is a meeting that I have every single week in the NICU ward. So all the healthcare professionals in the ward get together and they just discuss about the children, really, the environment the children are gonna go into. So for example, they talk about the parents, the family, make sure that the parents are okay, they're able to take care of the babies. But also, you know, for example, are the parents drug addicts? Are they alcoholics? Are the parents together? Is the dad abusive? Is the mom abusive? All of this type of things. So, for example, let's say you give birth and they see the parents arguing. So if they see the parents arguing, they're gonna note it down and then they're gonna talk about that exact argument. They're gonna quote everything they've said and have a discussion about it in the meeting and be like, is that baby in the safest hands possible? Is everything okay at home? Like, they talk about everything. And it was very shocking to see. I was surprised at first, but then I really do understand it. I mean, at the end of the day, you don't it's touchy. It's always touchy subject, because you want the baby to be in the best care possible. You want to ensure that they're okay and they're gonna be safe. So we're ensuring that, you know, there's no safeguarding issues at home. But also, for example, you might have a conversation where you're discussing whether the baby should live or not. And that's what threw me off. That, I can't lie, that threw me off bears. I was like, whoa. Like, they're literally discussing, I don't think we can take care of this baby. It's not gonna live. You know, if we keep doing this, is this right? For example, if we keep this baby alive for longer, are we doing the baby any justice? Are we doing the baby any good? Because eventually the baby will die. So is it right for us to keep this baby alive? Is it right for their own human rights? And I was like, wow, I never thought about human rights for a baby. Like, I never thought of it that deep. And then, yeah, it's so techy and complicated, but you have those type of conversations and it can be quite upsetting. Like, when I went home, I wasn't upset, but I was just spun. I was like, rah, this is, yeah, that's a big decision to make, basically. So, you know, just stuff like that. Also, you know, for example, look into the parents' family history. You know, the dad does this, so we can't. And then they'll have also conversations where they'll be like, we need to send the baby into care. The parents cannot take care of this baby. We are not comfortable with them taking care of them, and we're gonna send them to care. So just stuff like this, really, you know, big life decisions are being made in these conversations, all in the best interest for the baby, basically. So that was a very interesting conversation, basically, yeah. So week 4, back into my normal setting in the outpatients department, and I was thankfully able to shadow one of the physios who is able to actually assess babies. So babies from like 3 to 5-year-olds or whatever. And I wasn't allowed to do that, but I was able to shadow her, and it was so interesting to see, because her assessment, when you're assessing babies that young, children that young, it's so different. Forget about communication. If you tell them to like raise up this hand, they probably won't do it, because they're just in la la land, they're everywhere. So instead, the physio will be using toys to help assist in the assessment. So for example, if you want to ask the baby to move their head left and right to see, you know, do they have good cervical range of movement, are their muscles able to function well, is there any tightness, you'll use a toy and you'll wrap the toy around, and then you'll move it to the left and then to the right, and the baby will track it. The baby will just track it, and I'm like, that's so cool to see. You know, just using toys just to assist you in your assessment is a very smart move to do. And then also just being very interactive, engaging, very caring as well. you know, it's like an art form basically, the way I saw it, and it's something that's really interesting to learn. And week 4 was also a lot more independent, so I was assessing people myself now, by myself in the room. So more of that, more soap notes that I was doing. I was also leading a gym group, so in my trust we had gym groups for some of the patients, because some of them were in their teens, so let's say 12 and above. They had conditions where all they need to do is exercise, but we wanted to put them in the gym because they're quite active, and plus it's a good skill to do. So being taught how to use the gym at such a young age is such a great skill to learn basically. So I'll be given a patient, and then we have a plan, and we'll go through the plan. I'll teach them how to do the exercises, or I might need to adjust their exercises so that they're able to do it basically, and just stuff like that really. And yeah, that was basically week 4. Week 4, 5 and 6 are roughly all the same. So I was doing a gym group, I was more independent in my note taking, in my assessments. I was just trying to do things so I'm able to push myself and get through it, and basically, so that was basically it. If I was to give a global reflection of my placement, I would say that I started off very clueless, and every week I was able to learn a lot more, and my main issues were note taking, having difficult conversation with the patients or with the children in terms of serious illnesses, but also if there were a young woman, a young girl, talking about their menstrual cycle and stuff like that, which I found a bit weird. But also me adapting my questions for my subjective and objective assessment so they're able to understand it, but also timekeeping. So one of the things I got told was that I always got to work on time, but dead on time. So at 9 o'clock, I was there at 9 o'clock when I should be there, honestly, 8:50. Gives me enough time to prep. I'm not rushing or whatever. Another feedback I was given was I should be more upfront with my reflections. So I actually go up to my educator and tell them, hey, I've done this reflection, can we talk about it? And also I should be a bit more upfront with asking for feedback, because I think I'd never ask for feedback, it just happened, or if I'll only ask for it if I really need it. If I didn't need it, or I'll figure it out, because I'm the type of person, I love getting feedback, but I kind of want it to be told to me rather than me asking, if that makes sense. I find it a bit weird asking for feedback sometimes. Yeah, so if I was to do an overall reflection on my placement, I'll say that I had an amazing time. It was very, very worth it. I started off clueless at the start, so I had to learn the conditions. I had to get used to the note-taking format, the assessment sheet, my team as well, but also my responsibility, what I'm bringing to the team. So thankfully, I've got tons of sports experience. I'm able to cater to some of the kids who are very sporty very well, so I had to keep that in mind. But I also had to get used to having difficult conversations with the parents, listening to difficult conversations, and also listening to the children and patients and what they've been going through, and be able to take care of them. And you know, things I could have improved on, my time management. So I used to get to work on time, dead on time. So work starts at 9, I got there at 9, when in honesty I should really get there at 8:50, so that gives me enough time to prep. Another feedback I was given was that I should actually ask for feedback instead of waiting to get some. So after I do something, I might not say anything or might have a small discussion, but I'm not really asking for feedback, and it's something I'm definitely gonna take on board. Another feedback I was given, I should actually be a bit more upfront on my reflections as well. So there'll be times where I'll be on my phone writing what I've just done or what I thought about, but I wouldn't present it to my educator. So that's things I should also work on basically. And you know, my biggest difficulties were actually the soap notes, the note taking, and the difficult conversations basically for me personally. So overall, yeah, I really enjoy my placement, and I can't wait to get my second one, which starts in May. And that's it really. If you guys have any questions, please comment below, DM me on Instagram. Yeah, like, subscribe, share this video to all your friends and family, and also other upcoming videos that you know. And